Virtual learning fails children with disabilities. Hello, this is Robert Romano, Vice President of Public Policy with Americans for Limited Government, dailytorch.com. Hit that subscribe button. Today we're going to be talking about the virtual learning year that most students are engaged with right now. About 2/3 of students are learning from home, using the computer, talking to their teachers on Zoom, and I believe that this is going to negatively impact students, and in particular, students with disabilities. I know for a fact because my daughter has autism spectrum disorder, and she is not benefiting from the virtual learning environment in front of a laptop right now. And I believe that, again, this is impacting millions of students across the country. And so I just wanted to give you an idea of what some of these numbers are. And hopefully states and the federal government will act to reopen schools as quickly as possible, especially for those who are disabled. Schools across the country have begun the 2020-2021 academic year, and approximately 67% of the students in a snapshot by Education Week in 100 of the largest districts in the country are utilizing virtual learning, according to Education Week, in order to combat the COVID-19 pandemic. Those children have not been in a physical setting really since March. That's when states were shutting down. And this is probably impacting all the students who are at 7.1 million that are enrolled in public schools right now, students with disabilities that have special education. And if the breakdown, 67% of the 7.1 million, that could mean as many as 4.8 million special education students have not been in the physical learning setting for about 6 months. And according to Judith Sandalo, the executive director of the Children's Law Center in Washington, D.C., she told American University Radio that, quote, "Many children with special education needs are getting no education remotely," she said. Quote, "One student we worked with had begun learning to speak since the pandemic has literally stopped speaking, and we're seeing this over and over where students are actually going backwards without the sustained support of teachers and therapists." And I got to tell you, that's absolutely true. And I think across the country, school districts who are depending on distance learning, these kids are simply not getting what they need. My daughter, she's 3 years old now. She's been in public school since she was 2 with the pre-K program for special education students with hands-on trainings for her autism. And it's to teach her the social communications and other learning skills she'll need when she gets to kindergarten so that she can fully function in the general education environment. She probably will have that IEP for some time. But I believe that with this shutdown, she's definitely regressing. Putting a 3-year-old in front of a laptop really doesn't work, unfortunately. We're supplementing, and we have been, with this applied behavioral analysis therapy that she's been taking since she was diagnosed, and we're looking for more hours now to offset the fact that the special education simply is not there to the capacity that it needs to be, although we're working the best we can with it. And we know we're not alone. We've spoken with our daughter's teacher. She says that the schools are basically ready. They have the shields up. They have distancing and personal protective gear in place. Everyone will be wearing masks if and when they do open. But I have to say, even if all they're going to do is let the special education students back into school, I think they should do it as soon as possible. We've had enough time now. The CDC has issued guidelines on how to reopen classrooms, as has the HHS. They've delivered testimony. Dr. Fauci has talked about school safety with regards to this. The Department of Education has a lot of resources for schools and higher education and elementary schools to consider with how to safely reopen schools. The president himself and the White House have been focused like a laser beam with these federal agencies on ways to get the schools reopened so that we don't have so much of a problem here. And I think we do have a problem. The sooner the better, though, that we could reopen everything. Anecdotally, the schools, at least in Northern Virginia region, are pretty much ready to open. They say they are. And the decision to reopen, however, remains with the school districts, the counties, and the state, the governor, basically. And I would say the same thing applies to all non-special education students about the need to reopen. We have connectivity issues here in Northern Virginia. Sometimes the internet's not fully functioning, and so the distance learning is not as effective as it could be if the internet's crashing. And then you have the economic outcomes here, which is that COVID state lockdowns knocked millions of women out of the workforce disproportionately. About 13.4 million women lost their jobs versus 11.9 million men at the height of the shutdowns in April. Put another way, women make up 47% of the workforce, but they made up 52% of the job losses. So by doing this, by doing the lockdowns, we sent women back to, on a labor participation basis, back to 1986. I think we're back into the 1990s now as the states are reopening and 13.8 million people have gotten their jobs back. But it's definitely impacting our economy, and how long children remain away from the classroom could have years-long impact on their own development, their lives, future prosperity of not just themselves, but of the entire country. A Brookings Institute study found that the cost of the United States in future earning of 4 months of lost education is 12.7% of annual GDP. And with well over half of the country's states deciding to keep schools and universities closed until the fall at the earliest, much of this loss may well materialize. So this was earlier this spring, and the loss has materialized, and schools, about 2/3 of them in the largest districts, are still closed right now in September. When they reopen is anyone's guess, especially when one considers the fact that there has never been an effective coronavirus vaccine. I think that we have to question whether we're pursuing the right strategy right now with regards to schools being closed. And we may be closing the schools in vain. The vaccine has never worked for SARS. It never worked for MERS. We've never had one for the common cold, and we don't have one for COVID-19 yet. And I'll leave you with the close here. While there are several candidate vaccines in development, it remains to be seen if any of them will be effective, calling into question what plans schools have in place to reopen should the vaccine fail. One hopes that millions of parents a few months from now are not asking themselves the question, when confronted with the potential reality that the vaccine didn't work, that what were we waiting for? That's the commentary. This is Robert Romano, Vice President of Public Policy with Americans for Limited Government, dailytorch.com. Hit that subscribe button, ring the bell for notifications, and have a good day.